Thank you, Sarah. And Sarah's obviously already introduced me. I'm the Senior Content Marketing Manager at Babyscripts, and one of my jobs and my best loved job is finding patient stories and telling patient stories, because I do think that that's the best way to raise awareness about maternal health. Sarah, if you want to switch to the next slide. This is a story of a patient that we connected with 6 or 7 months ago who receives her care at Toro Health, which is a part of the LCMC health system in Louisiana. In front of you on the screen, you have sort of the basics of her pregnancy and postpartum experience. She was enrolled on Babyscripts at 21 weeks with chronic hypertension. Around 37 weeks, she started registering elevated blood pressure readings. She was called into labor and delivery and delivered early because she had preeclampsia. And then about a month after childbirth, she started experiencing symptoms that she was not familiar with. She thought that they could be blood pressure related. She took her blood pressure, did not discover any emergency situation, called her provider, and they actually called her into the ER because she was having a stroke. Recently, last week, I was able to catch up with Deidre and hear her story in her own words. And I think that it is best heard and told in her words. So we have her interview here for you to watch with us.
When I first became pregnant, it was okay at first. Like my blood pressure was just like, it was kind of like up and down. And then it just started constantly just like going up. I had to check my blood pressure 3 times a day, and I had to keep track of it like on a notebook. And then they introduced me to Babyscripts because they wanted something Bluetooth that every time I check my blood pressure, that it will automatically go to my doctor and they will get an alert about, okay, my blood pressure is fine. Okay, it's elevated. I need to go to the emergency room, or what to do. So that's how I got introduced to Babyscripts. And I had to still continue to check 3 times a day. And I just didn't have to log it anymore. And they were able to see that my blood pressure started getting into stroke levels. And so that's when everything became a problem. My health just went crazy. It was ridiculous, but Babyscripts really helped me out a lot because my doctors were able to keep track of my blood pressure, and so was I. So if it was after hours or if it was on the weekend, and of course the doctor's office is closed, they were still getting an alert, and they were able to still call me like, okay, we got your blood pressure, you need to go to the emergency room now. So that was during pregnancy. And they actually ended up inducing me a lot earlier than planned. My due date was February 8th. And because I became so high risk, they became fearful of preeclampsia with my blood pressure. And so the night before my appointment, my blood pressure was like 180 over 110. And they were like, go to the emergency room. The next day, I ended up getting induced because my blood pressure, it escalated again. And this time it would not come back down. Like it just kept rising and rising. But throughout my entire journey, thanks to Babyscript, we were able to keep track of not just me when I go to the doctor that once a month and so forth, but every day to see exactly what was happening, when was it happening, was it only happening because of something I was eating, or was it just happening because, okay, there's a problem. And that's how we found out it was just like my health problem, because I had to check it like multiple times a day. I still had to monitor. My doctor still kept track. And a month after having her in February, I had just checked my blood pressure throughout that day, and I was fine. But I was a little restless. But later on that night, I just felt off, like something just wasn't right. And it was like I was able to talk, but I wasn't able to talk. It was like the back of my throat just felt like really, really heavy. And I just felt disoriented. I felt kind of dizzy. So I thought that maybe it was because I was just tired, because Winter had waken up in the middle of the night. So I'm like, okay, I'm just tired. But it just like something just wasn't right. So the first thing I did after that, I was like, let me check my blood pressure. And it was fine. My blood pressure was really fine. It was like 128 or 130. Like it was fine. And that's how I knew that something else was going wrong. And I called for help and ended up in the emergency room. And from the time I had checked my pressure at home till I got to the emergency room, it had went up to like 210. And I was actually in the middle of having a stroke. So again, thanks to Babyscript. Like it was very, very helpful throughout my pregnancy, and especially after. And I still use it now. Like I still use it. My doctors no longer get track of it, but I still do have to keep track of my blood pressure. So I still use it to this day. I actually just used it yesterday. But yes, Babyscript has been a huge, huge part of my health journey and helping me keep track of my blood pressure, and even the app, like keeping track of my weight and different things like that. I was able to keep track of also. So I really have looked to Babyscripts for a lot of help. So it's been great. I wish that they would introduce it to everyone, because it helps out a lot. Yeah, so yeah, I still do use my blood pressure cuff from Babyscripts. It's still been a very big help, because that's one of the big things that they always look for, is if my blood pressure escalated when these strokes are happening, if my blood pressure elevated before, if it happening during, like I make sure I keep track of my blood pressure. Apparently, high blood pressure is really a silent killer. It has not affected me. I'm fortunate enough to have a really, really great care team of both races, actually. I have two gynecologists. One is, I think she's Asian, and I actually have a Black gynecologist also. Hey, Winter.
Oh, can we see her? Can we see her?
Yes. And I actually have two midwives that are Caucasian.
Hi, fancy girl. Oh, she's the wind.
Well, first, you just never know. Every pregnancy is totally different. So I would just say, just be mindful of anything that doesn't feel normal, because just the slightest little feeling of you being nauseous or vomiting too much can be a sign of something being wrong. And yeah, ask about Babyscripts, because blood pressure is a very big thing in pregnancy, whether we want it to happen or not. High blood pressure, it can happen, whether you're healthy, not healthy. It's just something that your body can do. So ask your doctor about Babyscripts.
Well, clearly my favorite part of this interview was when we got to meet Winter, who is Deidre's Babyscripts baby. She is actually a mother of three, but her daughter Winter was the first to be a Babyscripts baby. One of the things that is most significant about Deidre's story is how compliant she was with taking her blood pressure, and how aware she was of what constituted an emergency situation, what was an elevated level. So out of curiosity, we have a poll question for you. More than half of patients say they are confident they understand their blood pressure numbers. What percentage do you think of patients actually understand these numbers? So I think we can close out the poll here in a second. Okay, so 60% of you think 24%, 40% think a third. So the actual number is actually 36%. So 36% of patients actually understand what their blood pressure numbers mean, which is a good segue into what I'm about to talk about, which is using Deidre's patient story to highlight some of the increased focus, some of the trends that are happening in obstetrics, and the first of those being blood pressure related risks. So hypertension is getting a lot of attention. There's a lot of new data coming out around blood pressure levels and reevaluating what patients should be understanding about their blood pressure. One, I think, very profound statistic is this one here at the bottom left, that women nowadays are twice as likely to develop hypertension in pregnancy as their mothers, which may seem like a massaged statistic because we also know that women are having babies much later in life. So of course there is increased risk because a geriatric pregnancy is always going to have more issues. But this data actually was compiled taking that age difference into account. So it really does signify that there is an increased frequency of hypertension risks in pregnancy. And we are seeing more awareness of that at a national level. So recently, the U.S. Preventive Services Task Force put out a recommendation for measuring BP at every prenatal appointment, which may seem like a kind of nothing burger because, as most of you on the line know, it's standard practice to take a blood pressure measurement at a prenatal care appointment. I think what's significant about this guideline is that these risks are now getting federal attention. So this is not something that's coming from ACOG. This is a federal organization that is so aware of the problems that it is now formalizing guidelines around catching hypertension risks in the pregnancy period. I think it's a really hopeful data point because it shows that task forces, maternal health task forces across states, and congressmen that are advocating for maternal health on the Hill are actually making an impact, that we have something like this, some federal organization coming out with recommendations. Unfortunately, this recommendation is just around prenatal care and measuring for BP in the prenatal period. And as you heard from Deidre's story, and then also from data that we have, most women, a lot of women, sorry, not most women, about 10% of women develop hypertension because of pregnancy later in their postpartum period, so after their postpartum checkup at 6 weeks. So this raises a couple questions, a couple needs. One is, obviously there are women who get dropped from coverage at this time period, and there's not a whole lot that individuals can do about that. That's going to take some policy changes to make sure that women have access to postpartum care coverage beyond that 6-week period. But what we can do, and what I think is significant from Deidre's story, and Sarah, you can move on to the next slide here, is to really focus on education. So one of the things that I think this story gives insight into is how valuable it was for Deidre to understand from the beginning what she should be aware of in terms of her symptoms, her blood pressure symptoms. Even before she was on Babyscripts, she was tracking her blood pressure. She clearly had a lot of knowledge about what constituted an emergency. And this education in the prenatal period can carry through postpartum You heard also that Deidre is still taking her blood pressure, even though she's no longer on the Babyscripts solutions. She's using her cuff to take her blood pressure, and she clearly knows what is a matter of concern and what isn't. And I think establishing those habits in the prenatal period is really important for future health, particularly as hypertensive risks are directly connected to heart health. So there are long-term benefits to making sure that patients understand the significance of blood pressure risks from an early stage, and that they are continuously educated on what that can mean for their long-term health. A few other insights that I think this story gives to us. Deidre has a very non-traditional support system, so I think her story emphasizes the importance of having support systems that extend outside the hospital, a digital education layer that can be an extra safety net for women like her who, she is a single mom. She has 3 kids at home. She explained to us in a part of the interview that you don't see that now that she frequently experiences strokes symptoms, her 9-year-old son is the one actually that has multiple times been at home with her to catch these symptoms happening, has called his grandmother, has called 911. So having an extra layer of support there for women like Deidre who don't necessarily have a partner who is present, who can be with them, is really important. And then for those solutions to be remote, I think is also significant that they can deliver asynchronous care. Deidre works from home. We had some trouble connecting in our interview because she has a very limited time frame for when she can be on the phone. And now that she is experiencing strokes, she is not allowed to drive herself anywhere. She's not allowed to be alone. So just emphasizing the kinds of barriers to access that maybe are not the most obvious on the surface, but show the importance of having some kind of, again, digital safety net that can help a woman contact her provider, be connected to her provider, even if there are reasons why she can't get into the office. Deidre speaks so joyfully about her caregivers. I really love that part of the interview. She clearly, when asked if her perception of her care was changed at all by being a Black woman, she gives a resounding no. I've never experienced any difference in my care. And I think that just goes to emphasize the importance of having compassionate, diverse caregivers who can really personalize their care, be sensitive to the things that their patients are going through. And that was a topic that was talked about a lot at the Future of Maternal Health Summit, which occurred a couple weeks ago. Just emphasizing that there needs to be a way to incentivize personal care that's sensitive to lived experience, as well as care that is geared towards process-oriented outcomes. And then I think the last thing that this story gives us insight into, and this will be a little bit of a segue into our next section, is just what it means to have accessible content. So despite the fact that we did have some connectivity issues getting a hold of Deidre, her internet wasn't working at one point. She, again, she works from home, so she has very limited space to be able to talk to someone. She was very secure in knowing that Babyscripts would communicate her information to the call center. She always got a call from her provider when there was an elevated reading. So the sort of typical response to talking about implementing digital care is that people in underserved populations might not have broadband access, might not have Wi-Fi, might not have cell data, but that's actually not the biggest barrier to using technology. In fact, men and women in these underserved areas are often more reliant on technology than they would otherwise be, because that's sort of their only access to things like the internet. They have their phone. So what this story tells us is actually, and what the data shows is that the bigger barrier to access is actually health literacy. So whether the content is understandable by a certain population, whether it's engaging, whether it is, culturally sensitive, And we have done a lot of work with our solution to make sure that it is culturally competent, that we include a diversity of images and are sensitive to both the income diversity of the patients that we work with, but also their cultural diversity, also their whether they might be disabled in a particular way. And Emily Woody, who is our clinical content director, is best able to speak to that. So I will offer this as a segue into her section. And again, thoughts and prayers to her as she's going through labor right now.
Thank you so much, Emily. It's really incredible how that short interview with Deidre really could draw out so many points around how to provide better care for moms.